In 2016, Ken was suffering from back pain whenever he sat up. He could lie down and be back free of pain, but when he sat up, his legs just hurt him terribly. We searched and searched for doctors who would do something for him, but since he's 81 and has short-term memory loss, the several doctors that we encountered didn't want to touch him in surgery.
How are you guys doing? Good to see you again.
Good to see you.
He had some severely pinched nerves at L5-S1, causing a lot of leg pain for him. He also has a really degenerative back, and he's a little bit older. I felt that his most significant level and the one that was causing his main issues was that bottom level. And so I had told them that, I think we could keep his surgery a little bit smaller and then get away with it without causing too much problem for him and give him the most bang for the buck, so to speak.
He looked at the x-rays that they took here and decided he thinks he can help Ken, and we were so relieved. He operated on Ken on December 15th in 2016, and he didn't have any more pain. As soon as he recovered from surgery, he had no more pain. He could sit up, he could walk, he could sit in the car for the first time. We had traded cars so that we could put a mattress in the back end of the car, and he rode everywhere we went. He rode on that mattress. And one of the doctors at the med center says, that wasn't very bright.
He really had difficulty even getting around or walking or standing for any period of time. Functionally, his activities were much lower than what he had been used to, and I think he was getting depressed about that. After surgery, his leg pain's better, his back pain's better, he's back to walking. They've traveled and made some trips, and so from a family standpoint, it's really nice for me to see that it's impacted his life and his family's life so much that they're just really happy that he's kind of back to doing things.
It was hard on everybody, and that's why when he got the surgery and got free of pain and was doing so well, we took off for Florida for 6 weeks so that I could get my mental health back. Our oldest daughter had a thank you card on the table, and she said, I want everybody to sign this card and thank Dr. Cornett for fixing your grandpa's back.
And they had mentioned that they couldn't thank me enough, but I told them, that thank you card was thank you enough, and that's really one of the reasons why we do what we do, here at Nebraska Medicine and in the orthopedic department. That's not the only reason we do things, obviously, but it is always really rewarding to get that positive feedback from folks.
Quality of life was nil. It was absolutely gone. So
the surgery then changed all that.
Yes, it brought it all back, brought everything back to life. So it's a beautiful, beautiful thing that Dr. Cornett did for us.